Good morning, everybody. Welcome to Mineola Weissner Field. As you all know, this year it'll be 100 years since the first airplane landed on this field, July 4th, 1917. Airplane just like this one, Curtis Jenney, that was a U.S. Army Air Corps trainer. Captain, well, he was lieutenant at that time. Lieutenant Ralph Stone, looking for a place for an emergency landing field. He saw the pasture. My husband's father was 12 years old at the time, hoeing cotton. They saw the airplane, and you can imagine. And the rest is history. He became a barnstormer. He also later on became an FAA official, and he retired, and he was an examiner issuing out licenses. So anyhow, and that's in a capsule real quick. I want to introduce you to our speaker today. This is Dr. Niles Erikson. He's a very distinguished aviator, naval aviator. He earned his wings of gold. So big applause for him. He's also a flight surgeon, and he's going to be doing a presentation on basic med.
The topic today is the brand new medical certificate called Basic Med, and it actually becomes effective Monday. So I'm not from the government, but I am here to help. Before I prepared this, I did something that I did a lot as a military physician. I went to the original document and I actually read a federal regulation. Those of you who've never done it, it's a very painful process. So what I'm telling you is based on that, but it's not really official. So what do you need when you fly? Well, we all learned in primary training when you go out to the airplane, it has to have certain papers aboard. The old acronym ARROW, now AROW. Got to have those papers. Pilot's got to have papers too. The pilot has to have a medical certificate and a pilot certificate in order to go flying. We're all familiar with the first, second, and third class FAA medicals. That's what you get when you go to an AME and they do their examination and certify that you're qualified for those levels of medical certification. The newest thing, of course, is the sport pilot, who only needs a valid driver's license. That's their medical certificate. And now there is Basic Med. It is a fourth or fifth, depending if you want to count sport pilot, fourth or fifth medical certificate you can have and fulfill that requirement before you fly. All right, so this is a comparison. The major difference between Basic Med and the traditional, if you will, FAA medical certificates is you can get your Basic Med by going to any licensed physician. Your friendly family doctor who's known you for years is actually probably the best resource if they're willing to sign off on the form. Record keeping is quite a bit different. There are different prerequisites. There are training differences. In other words, what I tell people who come to me for an FAA medical is, well, this is an exam you didn't have to study for. Basic Med, you actually have to study for that. The Basic Med medical certificate carries with it certain limitations on the aircraft itself, whereas the medical certification under the traditional way does not have aircraft limitations. The limitations are tied to your pilot certificate, what type of certificate you have. We'll go through these sort of one by one. All right, so the thing that's brand new is that they finally published on last Monday what they call the Comprehensive Medical Examination Checklist. Before they published it, I expressed the opinion that what it's going to look like is exactly the paperless FAA medical exam. You go to MedExpress, fill out the questionnaire, bring it to the AME, they go online and they get an examination form to check out and then submit to the FAA. I opined that it would look pretty much like that, and that in fact is true. When you print it out, it looks pretty much like what you would fill out online. A little bit curious that the FAA has gone from, at least in the medical side of the house, they've said, well, we're working very hard on going paperless. If you've gotten an FAA medical within the last few years, you'll know that you can't fill out a piece of paper in the doctor's office and hand it to them as part of your application. You actually have to go online, fill out the same thing you would with a piece of paper, you used to with a piece of paper, and you have to have that all filled out before the AME can do the exam. It was all to be paperless. Well, now they've come up with Basic Med, where you must print out a piece of paper. And that's actually your responsibility now, is you go online, you download the form, you print it out, you fill it out, you bring it into your doctor, and they fill out their part. So, what's the big advantage? The biggest single advantage I can think of is that you no longer have to go online, look and find someone who has the designation as an AME. Truth be told, or my suspicion, some of this, the FAA went along with it in part because they've been having a hard time recruiting people to be AMEs, because it's really not a money-making proposition, and young doctors, don't seem to be particularly interested in it, not as much as us old guys. So the numbers are getting smaller, and you may have noticed that if you've tried to get an FAA medical here in this area. I, in fact, am faced with that very dilemma. I can't do my own, so I got to find one. But now you can go to any doctor. It has to be performed. The examination has to be at least signed by a state licensed physician. If you go to a facility where a nurse practitioner, PA, has the whole shooting match, if they do the exam, it still has to be signed by either an MD or DO. A potential advantage to those of you who have health insurance for periodic medical exams. I'm pretty sure that no health insurance covered an FAA medical as cost. Perhaps you can get it paid for by insurance. I'm not sure. The downside is, for those who are very young and their third class medical was good for 60 calendar months, the duration between exams is now at 48 months. So 4 years versus 5 years for the youngsters. But 4 years for us older folks is actually something of an advantage. That's how often you need to get a comprehensive medical exam filled out by the doctor. Disadvantage is we now have paper records again, and actually that's now your responsibility to both generate the paper record and either keep it or have access to a copy of it. These days you can scan it, have an electronic copy, and that will work as well. A third thing that I thought of strictly from the doctor's standpoint is some doctors may not have the ability in their offices to do certain parts of the exam so that they can't check off, well, I looked at this. The primary one I would think of is there is a checkbox saying, well, I checked the person's visual acuity, their color vision, and eye balance, and they may not have the ability to do that. If your primary doctor is, I'm going to tell a medical joke. This area here in medical school was called the orthopedic triangle. Why was it called the orthopedic triangle? Because the orthopedic doctor can take a stethoscope, put it right there, listen to the heart, the lungs, and the belly all at the same time in about 5 seconds while he's heading to the operating room. So some doctors may not have the ability to do certain parts of the exam, and they may not be willing to check that off. The advantage of not having a paper record or having the electronic record that the FAA generates, when you fill that out online and the AME puts it in his system, that means that the application is open. And if for some reason that application is turned down, the FAA is going to know that. They're not going to know about basic med. You come into your doctor with this checklist and they say, nah, I really can't do this. FAA is not going to know that. But you are required to keep a copy of the completed checklist, either electronically or in paper yourself.
Question on that.
What's that?
Question on that.
Yes.
As you go through to the next period and you've got another checklist and another certificate, can you dump the old ones from your logbook, or do you have to just keep stacking them up?
You can dump it. The situation where it would unfortunately come into question is if something happened and the FAA comes to you and says, well, let me see when something happens now, they want to see your medical certificate and your pilot certificate and your logbook, insurance form, whatever. You have to be able to produce that and show that you're current with that. In order to come in and get an FAA medical certification, doesn't matter what class, 1 through 3, what are the prerequisites? Prerequisites are 0. In fact, when I went through the AME course for the first time, they actually mentioned the fact that mom and dad can bring in their 6-month-old baby for a first-class medical exam. And legitimately, if you can document their hearing and their vision, I don't know how you do that on a 6-month-old, but there are no prerequisites for the FAA medical certification. There are for basic med. Basic med has a prerequisite that you've got to have a valid state-issued driver's license. Has to be U.S., not the possessions or international licenses. And that is something you have to carry with you when you fly. You have to have a form of ID and a driver's license, and certainly a driver's license would fit. In order to be certified under basic med, you must have had a valid FAA medical within the 10 years preceding the passage of the law. And that comes out to be July 15th, 2006, yeah. The law was passed on the 14th, and as long as you had a valid FAA medical, whether it has special issuances or any other conditions put on it, and it wasn't suspended, withdrawn, revoked. So what about somebody who's never had an FAA medical? Well, you still have to locate an AME and get some class, doesn't matter what, FAA medical done. Well, the original intent was to make basic med the sport pilot equivalent, and the FAA just didn't buy off on that. And that's why they put all these additional conditions on it.
Congress didn't buy off on it.
Yeah. Well, to be honest, I think Congress was pushing harder than the FAA, to be honest.
A doctor? Sir, on the special issuance, it says revoked, suspended, withdrawn. Withdrawn kind of, I don't quite, withdrawn by the FAA or just not went in for renewal, or what would you say withdrawn?
Withdrawn is a condition where the FAA basically writes you a letter and says, send me back your certificate.
Okay, so it's essentially revoked then.
What's that?
Be the same as revoked then, I guess.
There's a legalistic difference, and for practical matters,
I had a special issuance and I just didn't go back in for a third class because I thought maybe I wouldn't get it. So that wouldn't be considered withdrawn, is it?
Nope. That would fit the bill. Okay, so And then if you don't have an FAA medical within the prior 10 years, yeah, I mean, if you just let it expire, yeah, if you just let it expire, that's fine. All right, so as I said, I tell people that the FAA medical exam is one you don't have to study for. Well, this one you do have to study or at least take a course. The online course is available supposedly from a number of vendors. The only one I'm aware of that was released last Monday was AOPA. AOPA released their online course. You need to perform the online course every 24 months. So the exam's every 4 years, the course is every 2. And the course is actually the vehicle that the FAA has for tracking. Because at the conclusion of the course, you can print out a certificate of, I took the quiz, I passed the course, but you also submit additional information, and the certificate, again, that you have to keep either the physical piece of paper or an electronic copy so that you have access to it. You don't have to carry it with you when you fly. So those are the record-keeping requirements you have. Now, as I said, the course itself is the FAA's mechanism for tracking people. It's their mechanism for tracking, have you had your comprehensive medical exam? It's the way that they get that signature on the front page that you fill out saying, yes, you can go ahead and check the National Driver's Database to make sure I haven't been picked up for DUIs and stuff like that. You also certify that, yes, I know I shouldn't fly if I have a medical deficiency. It also includes in there the date of your comprehensive medical exam. So in order to get basic med, there is a sequence that you have to do these things. You need to do the comprehensive medical exam first, and the doctor should fill that out saying, yes, good to go, this is who I am, this is my address, this is my license number, which I don't even know my license number, I have to look it up anyway, because that's the information you have to include at the end of the course, saying I have had my comprehensive medical exam on such and such a date by this doctor whose medical license is this. And again, the course needs to be done every 2 years, so you can use that same comprehensive medical exam that you had 3 years ago and keep your basic med certification current until you need your next medical exam in 4 years.
Yeah, but it won't let you print out the certificate for the course until you've had that information of going to the doctor.
What's that?
It will not let you print out the certificate for the course
Yeah.
until you have all that information.
Yeah, I believe that's part of it.
I know, I went out and tried it.
Yeah, as I said, this is the FAA regulators hate to give up power, and this is their way to track you, is doing the course. Flying under basic med, most of us are just fine. There are limitations on the aircraft you can fly. You can only carry 5 passengers, can't go above 250 knots, can't go above 18,000 feet. And that actually includes any part of a flight. So you take off going 125 knots, climb up to 19,000 feet and go 300 knots and then come back down after 15 minutes. That's not okay under basic med. Basic med also does not allow you to fly for compensation or hire with the same limitations that you have for private pilot certification. I mean, you can do some charity things and the same limitations you have as a private pilot.
But that limitation is indicated airspeed, it's not actual ground speed. Is that correct?
Yes.
Right. Get one of those nice tailwinds and go 300 knots. That's
Yeah.
cool. Uh, It does not limit you to VFR, doesn't limit you to single engine, multi-engine, rotary wing, all those are good. Those are the only limitations on that. Oh yeah, I forgot about the max gross, 6,000 pounds. If your airplane weighs over 6,000 pounds max gross, basic med doesn't apply. Only medical certification I'm aware of that has aircraft, other than sport pilot. So, the formula is, if you've had a valid FAA medical within the prior 10 years, and you have a valid U.S. driver's license, go and take the course, go and get your exam. That's the sequence to do it. Go and get the exam, get your family doctor to sign off on it. Go take the course, include the data that they want to keep track of you, and you're basic med certified. That doesn't mean that your third class medical is void, or your second or your first. You can certainly maintain both. Yes?
Do you, after you get your doctor to sign off on it, do you have to do your 24-month? Can you wait 24 months to do your online thing, or do you have to do it right after that, and then wait 24 months for the next one?
You don't have to do it right after you do the exam, but you aren't basic med certified until you do the course.
Okay, so
And you have to do the exam first.
Okay, so you have to do both of them then to get basic certified.
Correct. So, and what you need to carry with you on your flights, instead of a medical certificate, you can have your valid driver's license. And you are good to go.
Yeah, they should be reversed up there.
What's that?
I think they should be reversed. Comprehensive med and then training.
Yeah. I got the order reversed.
Yeah.
There is actually a sequence.
Yeah.
That's the correct mathematical formula. It's just not in sequence. So this is the summary chart. There are differences in who you go to get it. There are differences in what records you need to keep and whether or not paper is involved. The prerequisites we talked about, training, and it is limited for the aircraft you can fly. Yes, sir.
Are you, since you're a flight surgeon or whatever, are you going to do this, if you have all the stuff to do the vision and all this, are you gonna have a separate practice to do?
And that's actually one of the frequently asked questions on the doctor side is, our AME is going to do this. I want to do it. I mean, why not?
Yeah, I mean, you're not doing the
Not doing
the
other
other,
things.
but you're doing being a doctor, and you have all the equipment to do it.
Exactly. But or I don't know why an AME would elect not to do it, but that it isn't a requirement.
It's a source of income for you.
Well, plus I get to talk to pilots. That's my favorite.
Dr. Erikson,
Yes.
if you were to do those, would you require any different kind of paperwork that a pilot would bring in for basic med? Would they need to bring anything to you for their different medical conditions?
I think that would probably vary on a case-by-case basis. If the individual came with, I don't know, high blood pressure, heart disease, whatever, I would definitely talk with the individual and say, well, have you done this, this, and this? And in that case, it would be more useful for me. If I'm going to sign off on it, I want to know that the individual is under treatment and optimized for whatever. There are three medical areas that your family doctor is warned to be particularly cautious about. One is cardiovascular disease, folks who've had heart attacks and valve replacements and so forth. The other is neurologic things, epilepsy, loss of consciousness for unknown reason, and psychiatric things. So if that's part of your history, that's where your family doc may or may not be anxious to sign off. What I don't know is there's a whole long list of medications that the FAA really dislikes. The way your family doctor is going to be informed about those is they're required to go to a source that the FAA publishes called Don't Fly, Don't Issue, and busy docs, I'm not sure, are actually going to be all that anxious to look up an additional source online and read it and decide if they're correct in issuing or not. So that may be a source of hesitancy.
One of the benefits coming to someone like you is you know.
Yeah, I know all
You
that
know
stuff.
all of it. So
Unfortunately.
that's why people, that's why you can be busy.
Yeah. And I believe, I actually called AOPA and asked them a question because someone had asked me, they had had a certificate and they got placed on one of the medicines that they don't like and they were doing fine on the medicine. And I said, so can I be certified under basic med? And assuming that the doctor signs off, says, you know, heck, all my patients are on this depression medicine. They feel good on it, so you're fine. The FAA actually doesn't like that, but are they going to pick up on it? I don't know. In that situation, I think the FAA still wants you to go through getting a special issuance for being on a medicine they don't like. But how they're going to enforce that, it's anybody's guess. Yes?
Is it still true, like if you haven't had a medical within the last 10 years, you go to the examiner, the FAA doctor, is it true that if you don't pass that, then the law says you can't fly anything? Is that right?
Well, you're asking about sport
Sport
pilot?
pilot, sport pilot, yeah.
Can't fly.
That's probably true.
Why is that so important?
Well, so I told you I spent almost 30 years in the Navy. The last 10 years, I was actually, 9 years, I was actually in charge of training doctors to do this aerospace medicine stuff. So I trained the Army and the Navy doctors who actually set these silly standards. And I can tell you that science lives over here, regulations live over here, and sometimes they talk to each other, but sometimes not. The other thing I can tell you is if you come to the AME and they tell you, I really can't issue the certificate, I have to defer this to my friends in Oklahoma City, and they write back and forth and say, well, you need to send me this, 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 this. And you go through the hoops of getting a special issuance. I'll make it a multiple choice test. People who are in that situation work on getting a special issuance. The number who ultimately get firmly denied and never get the special issuance is 20%, 10%, 5%, which is correct. The correct answer is actually less than 1%.
Yeah.
Less than 1% of people who go to their AME and they say, yeah, I can't really issue this. You need to go through extra steps to get a special issuance is very low that ultimately get turned down. And the ones that ultimately get turned down are people who are crazy, people who are addicted to drugs or alcohol, people who have epilepsy or some other reason to suddenly lose consciousness. Those people almost never get certified. Almost everybody else can. When I first went to AME training, they said, here's a list of 12 conditions for which you can, when I examine somebody, I can either certify them, deny them, or defer them. Denial is a legal process, which means, no way, you're never going to get this, and you have to go to court to overturn it. If I defer it, then it goes to the folks in Oklahoma City. But anyway, they said, here's a list of 12 things which you can deny as an AME. And of those 12 things on there, with the exceptions that I gave you, crazy people, criminals, and drug addicts, with those exceptions, virtually every single item on that list of things that they said, nope, you can deny them and put them in legal limbo where they have to go to court to get it back. Every single one of those, they've certified people, at least for third-class FAA medicals. They've got people insulin requiring diabetics flying. They've got people with, no arms, no legs, one eye, heart transplants. All those people have ultimately been certified. I'm not saying it's easy or quick, but getting a special issuance is, when the AME tells you, I can't issue this certificate, that's not end of story. It's just the beginning.
Yeah.
Potentially of a pretty long story.
Expensive. Very expensive.
Yes,
What's
sir.
the impact if you go to an AME for a basic med, he doesn't like it enough to sign it? Does that have the same impact as denying a third class?
No. That's the advantage of basic med is FAA never knows that you've started it.
Even with an AME?
Yeah.
Yeah.
Yeah, I have no way, the way I have of communicating with the FAA that we've started an exam is I download your application.
So it's a practice medical is what it was.
Yeah.
I didn't know you did that.
Several times, no.
Back in the good old days when we had paper forms that you filled out, and I filled out a piece of paper and mailed it in and stuff, they considered those, I was supposed to keep those applications under lock and key.
Yeah.
As a matter of fact, I point out to people, there's 17B. It's also the same number on the basic med. Further explanation of the question that people always answered incorrectly, but it came out, I don't know, 5 or 10 years ago, and they had to, because they added this one question, all those old forms were invalid, so we had to send them all back and get a new packet of them. But 17B is, do you ever use near vision contact lenses when flying? And nobody knows what that means. So half the people answer it incorrectly, and half the people answer it correctly because it's like a flip of the coin. There was one aircraft accident where a pilot had one contact lens for distant, one for near, and he ran off the end of the runway, and they said, that's the reason that he did that. So ever after they had that question on that, and it's on this checklist as well. Yes, sir.
After applying with the basic med, and I have a occurrence that requires an operation, do I go back to a doctor to get it recertified? Can I do that myself? Can I determine what I can fly again?
The dirty little secret about medical certification is there's a regulation that says we medically self-certify every time we fly. There's a regulation that says you can't fly if you have any medical condition that makes you not capable. So you need surgery, you're on medicine for pain, you've not recovered. It's just like the current medical. No, you don't have to. And again, at the end of the course, I believe there's a statement that says, yes, I know I can't fly when I have some medical reason not to, but it doesn't invalidate your medical. And I think it's pretty much true with basic med as it is when you have your FAA medical first, second, or third class. There's nobody that can take that away from you except the administrator. And they will send you a letter and say, send it back. Same thing with your pilot certificate. They can't take that away from you unless the only person who can take that is FAA administrator. Anything else? Yes.
When if a guy hadn't had a medical in the last 10 years, so he goes to his AM doctor, and is he going to ask you about your condition? Hey, have you had any bypasses or all that?
Oh, yeah.
Oh, yeah.
If he does,
Oh, yeah.
do you need to bring along to him a copy from your cardiologist saying your health condition?
It's probably a good idea to have those, because what happens from my perspective as an AME, when I hear somebody like that, I say, I cannot issue this certificate. I must defer it. So I defer it to Oklahoma City, and they'll correspond with you, and they'll say, send me this, send me that, send me this. And they may, those are the individuals who've had special issuances for something like bypass or stents or something. Currently, in order to maintain their special issuance, about once a year or something ridiculous like that, they have to get special treadmill tests and echoes and EKGs and Holter monitors and who knows what, which truly aren't medically indicated, but the FAA requires them to maintain a special issuance. In basic med, the advantage is you get your basic med, you go through that special issuance once, and then it goes back to common sense. Your heart doctor says you're fine. You don't have to have those special tests to maintain it unless your heart doctor thinks so. And you can maintain basic med without that once a year spending gazillions of dollars to get all these special tests. So that's the individual that's probably going to benefit most from basic med.
When somebody has a special issuance issued to them, does it reflect that on their medical?
The way it's reflected in the medical, typically, when you get a special issuance for migraine headaches, which I happen to have, by the way. When you get a special issuance for a condition, diabetes, it will require me as the AME to give you the medical certificate time limited. And it will say, this is only good for a year.
Okay.
Now, some conditions like diabetes, you can bring into the AME certain records, you know, showing what your blood sugar is, what your A1C is, various tests, and the AME doesn't have to do the whole exam again. They can reissue another certificate for usually 1 year. But that's really the only limitations that will show up. Well, there's a whole list of them. Typically they have to do with vision.
Yeah.
Or if you need special assistive devices for controls, that kind of things. But the limitations, it doesn't say you have a special issuance for heart disease. It says you have a certificate that's only good for a year.
Gotcha.
Got a question.
Yes.
My doctor asked me, had a complete physical in February. My FAA deal was up, last month. And he said, well, can I use a lot of that data, you know, come in for, you know, a look at, and use that data from February for that, save him some time, what he was looking for.
As far as I know, if your doctor is willing to say, I examined you in February and sign that form, the checklist, that's fine. The comprehensive medical exam just has to be within the preceding 48 months.
Blood work did over.
What's that?
Did blood work did over.
Yeah, all that fun stuff. No, you don't have to do it again. Now, on the other hand, you've had your FAA medical 6 months ago. That doesn't count. There you have to get the checklist filled out, unless the AME is willing to say, well, we did this 6 months ago, I'll sign you on. Yes?
I have something called a statement of demonstrated abilities.
Yes.
My AME told me to keep it with my class certificate.
Yeah.
So I have to continue to keep this statement of demonstrated ability with my basic med.
Short answer, I would say, is no. It kind of depends a little bit of what the SODA is, the statement of demonstrated ability, is related to. But no, if your doctor looks at the checklist and says, I see nothing here in your medical condition that interferes with your ability to fly, and they sign it, you're good to go. Yes?
If your primary physician that gives this exam can't do the eye portion of it, you have to go to an ophthalmologist or somebody else to complete
Well,
that?
the way the checklist, and I looked at it before after they published it, there's a section on there that says Well, basically, every part of the physical is, yes, I examined, or yes, I verified that it's okay. You know, you get your vision checked when you go to get your driver's license. If they say that's okay, that's fine. They don't typically test your color vision, so that's one thing that may not be there. You can certainly do that and bring it into your doctor and say, my color vision's fine, my eyes point straight ahead, my acuity is this. But again, that's the advantage of going to your regular family physician who knows you and says, you got no visual problems, I've looked at the eyes, they work fine, and check it off. Yes, sir.
My third class is good for 48 months. I don't have to do anything with this basic med until that 48 months is up.
Correct. We don't have to do anything with basic med ever. You can continue to get a third class. You can have a basic med, second class, first class, third class at the same time. I'm actually thinking very seriously of doing basic med, which you can do even as an instructor. But if I wanted to hop in an airplane, charge somebody for taking them, whatever, then I would be flying outside the allowable basic med parameters. If I wanted to hop in my jet and climb to 32,000 feet, go 300 knots, I can't do that under basic med. But if I have second class, first class, third class, I can do those things.
You can
Go
instruct.
to basic med, you have to do that every 2 years then, after you started, right? Is that what, am I not understanding that
The
right?
comprehensive medical examination, the checklist, is every 48 months.
The online.
The course is every 24. So every 24 you go and say, yeah, I had my comprehensive medical exam done 3 years ago. For all I know, they may send you a letter and say, hey, you need to get another one of these done. I don't know how they're going to manage that. Yes, sir.
I unfortunately missed the first part of what you were discussing with the monocular vision. I know you have to certify that you don't use contact lenses for near vision. That's what we've always had to do. I was hopeful that with this basic med, we would get away from that because it's ridiculous. There are very few folks that do that.
Well, and almost nobody knows what that means.
Exactly.
When it
Now,
comes up in
I am that way. I use that. It's like getting your vision back. And it's a wonderful thing.
Yeah.
It's dependent on the individual, though, as far as your depth perception, and I understand that. If you can pass your check rides, why would they have that on there?
Well, I think I actually know the individual who got that added to the questionnaire. Actually, I think he's now the head of the FAA medical. And I disagree with his findings that that was a
It's a
fact.
CYA thing, it has to be.
You don't use two eyes to judge distance beyond about 20
Right.
feet.
Exactly.
Beyond 20 feet, you're only using one eye anyway.
Explain to me what the anus block has to do. I mean, what is a doctor expected to check? We've already had some people go through their exam, and they both chuckled about it, and the guy basically thought that doesn't work. Well, it served me all right for years. I mean, what is the check? Why is that block there?
You're asking me to explain a regulator?
We need to know what to tell the doc when we go through that part.
Yeah, I believe some of you'll actually see at the top of the checklist, blocks one, I think it's 1 through 3, they say omitted. Well, why do you have to have, on the form, why do you have to have a block that basically has nothing in it? I think, my understanding is the language of the law actually required the FAA to use the forms that I use as an AME as the template to create their checklist. So everything that is on there to be checked off as examined and okay and so forth, actually has a corresponding block in the prior form, including 1 through 3, which are omitted. Yes?
Basically, how does the basic med affect the CFI?
It doesn't.
Doesn't really. The CFI has the ability to perform instruction under basic med.
And you can give the flight review.
Yeah,
Still current.
I'm planning on going to basic med for my instruction primarily because I can't find an IME. I have to find one. I can't do my own. Can't do my own, can't do my family's.
But you can be a certified flight instructor with basic med and instruct a student even though you're for hire, because the student hires you.
Well, the rationale for that is, even if you're taking money as a CFI, but you're piloting as a PIC under your pilot certificate. It's regulations. Don't ask me to explain it. Most CFIs are like me. I can't figure this out. I'm just going to keep my second class current. Yes.
Do you have kind of a sense as to how many normal family doctors are going to be willing to sign this thing? Have you talked to any of them?
I really don't have a good idea about that. Well, not most. A lot of family doctors sign off commercial driver exams and other occupational exams. It's really no different than any other occupational certification.
The American College of Family Physicians came out with a position regarding the basic med, and they suggested that they look into it very carefully because of the liability issues. So that's their standpoint.
And that's a perpetual concern. Even as an AME with other specialties, that's been a concern for as long as I've been doing it practically. And what they told us is, well, you're a representative of the FAA because of the designation, and all you're doing is the equivalent of an occupational certification. So it really doesn't establish a doctor-patient relationship. Now you go to your family physician, yeah, you've got a doctor-patient relationship with that individual. So that issue is still out there, and that may be a reason they would say, well, I really don't want to sign this.
I took the form to my doctor this past week, and she's going to call me and let me know whether she's willing to do it.
I don't think it's going to be as big an issue as people are concerned about. But that's just my gestalt.
You said before, a PA can't do this, it has to be a MD.
PA can't sign it. The PA can do the exam.
And then have the MD that
Yeah,
they work
yeah.
with. Yeah.
The checklist itself, again, I'm not sure why, but that's written in the law. It has to be a physician signing the checklist.